Hi everyone, my name is Aaliyah Cuevas Iniguez, and I'm going to be talking to you guys about COVID-19's economic impact. So, what is COVID-19? As many of you may know, COVID-19 is actually the pandemic we are going through right now. We're going through it because of this virus, and many of you may have already gotten this virus, but COVID-19 is basically a mild to severe respiratory illness that's caused by coronavirus, and it's transmitted through contact with infectious material. You can get this by touching objects or surfaces that have been contaminated, and it causes a cough, shortness of breath. It almost has symptoms as if you had the flu, but if not treated, you can get pneumonia from this, and it's also deadly for some people. And it can be very scary because you just don't really know how this virus will affect you. For some people, it actually can cause death within 3 days. But to correlate this to economics, in December of 2019, the coronavirus actually entered the United States from China, and it spreaded pretty fast. There was a man from Seattle who was one of the first cases, and right after they found out he got it, it just spread crazy. And I feel like a lot of people may know or have felt this, but the government basically panicked because they did not know how to control this disease, and they're still learning about it. And it was scary because it was causing deaths, and a lot of people also panicked because of this. And so the only option at the time was to completely basically shut down America. And this meant that all places and stores had to shut down unless they had groceries or cleaning supplies. But if they didn't have that, they had to shut down to the public. And this pandemic is obviously still ongoing, but you could kind of see how that correlates, because if the businesses are shutting down, that means our economy has to be shutting down in a way, because although it's a health-related issue, it also relates to economics. My thesis is that the government seems to be focused on the health side of COVID-19, when in reality, COVID-19 has greatly had a negative impact on the economic side of it, because people have lost their jobs, their businesses have shut down, and houses are being lost. Therefore, the government should provide subsidies to help those in need. So my first point is that if businesses would have received the grants or loans that the government should have provided, they would have not been forced to shut down completely or cause drastic changes, which this will lead to point 2. But as of now, many businesses became financially fragile, and some businesses were probably already struggling, especially small businesses or new businesses. And grants or loans would have greatly helped. But it seemed to be like that the only solution was to close down those businesses, because it was just a health issue, and too many people were coming in contact with others who had COVID-19. So it was kind of a forced thing. But if the government was prepared for this, there could have been ways to financially help these businesses with the process of shutting down. Whenever this was mandated, about 43% of the businesses had to shut down, and a majority of these businesses only had $10,000 or had enough to last them a few months. The pandemic is still ongoing, so there is some businesses that made it because there was a reopening, but there's businesses that sadly did not as well. Point two, which was kind of leads from point one, this was why if businesses would have helped, if the government would have helped businesses in the beginning with finances and given them grants or loans, then it wouldn't have necessarily led to this, but it did. If businesses would have received the grants or loans the government should have provided, then unemployment rates would not have drastically increased. Because businesses were forced to make changes, some of these changes meant that they had to fire a lot of their employees in order to make ends meet. And it was reported that businesses reduced their active employment by 39%, and it reached the all-time high level of 14.8%.